aware that macular degeneration is the leading cause of vision loss, affecting more than 10 million Americans? Get this, more than cataracts and glaucoma combined. All right, that's terrible news. Even worse, macular degeneration is considered an incurable eye disease, so prevention is key. I want you to meet once again, back in our Sonoran Living studio, Dr. Joe Myers. He's a medical optometrist with Nationwide Vision Centers with ways to make sure this eye disease does not happen to you. Good to see you again, Dr. Joe.
Good to see you. Thanks for having us.
Oh, no, I'm glad you're here. Yes, absolutely. When I was reading some of the statistics on this, I was blown away. I had no idea. Explain to our viewers at home what macular degeneration really is.
It's, well, it can start with just a buildup of a lipid or protein deposit in the back part of the eye. So the tough part with that is the stage is so drastically different from having no problems at all, being able to see everything. We talked about the cell phones earlier, cell phones, computers, being able to see everything relatively well, all the way up to a loss of vision. And our graphic here does show the center of the vision completely normal. In later stages, that's exactly what a patient would see, where peripheral vision seems okay, but the center of vision is still moderately affected.
And that's what you see all the time?
That is it, and that is due to consistent damage, and that's never coming back, which is the importance of having this checked.
Absolutely. Now we're looking at a normal eye on the left. The macular degeneration is on the right. It's kind of hard to see, but where is the problem occurring?
Yeah, and I think probably the best part of this graphic is how small and discrete this spot that can really affect it. The center of the vision is 95–96% of where we get all of our vision from. Right next to the optic nerve, the bottom right is a very, very small spot, and that's the only part that's affected, but it affects such a large part of what we see.
Wow. All right. Which, once again, we talk about eye exams and how important they are. This is yet one more reason to have them on a regular basis. Let's talk about symptoms, because how would you know if you have this disease?
Well, that's kind of it. Kind of what I mentioned earlier. Not a lot of things can be wrong. You can have 20/20 vision. You can have vision all the way up to what we call count fingers, where you can't even see a hand in front of your face.
Wow.
Obviously, in those stages, hopefully patients have been seen by then, but missing parts to your vision, dark spots, and just that bottom one, loss of visual acuity, or how we measure the vision in general.
Who is at risk for macular degeneration?
Smoking is one of the biggest problem spots here. Two times as many patients that are smokers can have a breakdown in those in the blood layer of the back part of the eye. You get what's called vasoconstriction, where the blood vessels get very small, and you get almost toxicity to those cells that can damage the cells. It's a permanent loss, so when it happens, and it's not coming back. There's a lot of things I tell my patients all the time. There's things with the eyes that we just can't say, take this pill for 10 days and you'll be better.
Right.
Macular degeneration is one of them, and we need to consistently follow patients to watch for change.
And that's what's really important. That's the takeaway today, is that it is incurable. So if you get it, is there a way to prevent it from going any further if you catch it early?
In the early stages, not so much treatment right now. Actually, in research stages, they're starting to develop some pills, even some eye drops. They're challenging doing laser much earlier and treatments of injections much earlier. Classically, you usually see in the wet stages where treatment is being done. That's with injections and lasers and things like that, but that's to save the vision. It's not going to make it better. I can't stress that enough, that it's just important to get in and have the eyes checked.
Absolutely, absolutely. I'm surprised about the smoking and thinking that maybe it was genetic or even age-related.
Family history is the other side of that, and there's a lot of other things that we can watch for, but I think the biggest clumps for our patients are smoking and a family history. Those can lead us in that direction very quickly.
So the good news is that it is preventable.
It is, yes. Well, like I said, to slow that process down, the earlier that we see those signs, the better off we're going to be. The earlier we see those changes, we can work at it. And in the future, who knows, in the next couple years, we might actually have a true prevention. I used to say 10 or 12 years ago when I started my career that the man who comes up with this is going to be a millionaire, because there's so many people that are affected by this. I don't think we really have a grasp of what that is yet, but I think we're headed in the right direction.
Okay, encouraging news. Thank you, Dr. Joe Myers. We appreciate you. And like I said, if you're experiencing any of those symptoms, run, don't walk to the eye doctor. To find out where you can find a Nationwide Vision Center near you, they have several locations to choose from. Call 1-800-EYE-CARE or visit nationwidevision.com.